My name's Emma Tennant. I'm aged 48 and I was first diagnosed with GIST in January 2009, which was when I had emergency surgery and they found an 11 centimetre tumour attached to the outside of my small bowel. I first knew something was wrong probably about a year before that. So I was tired and I was suffering from, I realised I was suffering from unexplained anemia. I nearly fainted on the way home from work one day. And when I went and got a blood test, it was, my blood count was 7, where it should be 12 or 13. He didn't examine me. He didn't really ask me many questions. He just said, well, you're a woman, you're going to be 40 this year, it'll be down to your periods. But he just told me to take 600 milligrams of iron every day for the next 6 months and then come back and see him. I started to get really severe pain in my lower abdomen. By 4:30, 5 o'clock, my eldest daughter found me on the floor of the bathroom, doubled over in pain. By 7 o'clock, I was taking every painkiller I could find, and we'd called the emergency doctors. And I think by about 9 o'clock, we had an emergency doctor come to the house, and they admitted me to hospital. The next day, they got the CT scans over. They did an X-ray and an ultrasound. They told me there was something there, but they didn't know what it was, and that they would do emergency surgery. And that's when they opened me up and found this tumour, which a week later was confirmed as GIST. Generally, if you catch a GIST, if it's 5 centimetres or less, then the likelihood of it recurring is much less. So the fact that it had got to 11 centimetres by the time it was found meant that I was really high risk of it coming back. And again, that wasn't properly explained to me post-surgery by the surgeon that I had, probably because he wasn't a GIST specialist either. So the fact that when it came back again as well, that was another shock. So I now have cancer for the rest of my life, and my life is probably going to be shortened, and that may not have been the case. Post-surgery, I was told I was clear of cancer. They got rid of it with good margins, which is great. So I sort of just concentrated almost on, being cancer-free. I didn't really focus on GIST itself, what it had been, or the cancer, because by the time I knew I had cancer, it was gone, because, it was emergency surgery, and by the time I woke up and they said, oh, it was a tumour, it was out. So I sort of just concentrated on the fact that it was gone and trying to be healthy and, being grateful that I could live a normal life. On my final 3 monthly scan, I was told that it had metastasized and come back in a number of places in my abdomen. And at the same time, they told me they wanted to put me on Gleevec or imatinib, which is the first line treatment for GIST, and that they would take my scans from 3 monthly to 6 monthly. I decided at that point to take things more into my own hands, started to really learn much more about GIST, got hold of GIST Support UK, found out much more about the condition and found support with them, and realised that I could actually ask for a second opinion. I continued with taking Gleevec for around 3.5 years. I also got, at that point, I got mutational analysis done on the tumour, so I could understand what mutation the GIST was, and mine was one of the rarer types, which meant that actually rather than the standard dose of Gleevec, I should probably be on double dose, so I was on double dose for about 3 years. At that point, everything was sort of being held stable. I didn't get much shrinkage. Some people have incredible results on Gleevec. Mine just sort of held the cancer stable. Long term, it's difficult to say, really. It's just, keep taking the tablets and hope that it keeps managing the growth. If it stops managing the growth, then probably at this point in time, I'd be looking potentially at trials. I think for GPs, I'd just say, please take the time to consider other options. That just because somebody is a certain age, be that older, just often affects much older people than me, or 40 as I was. And a lot of the symptoms are quite generic. If somebody's saying that they're not feeling right, and that they say that they don't believe it's down to, I knew it wasn't down to my periods. I knew that was wrong. Please, check out more things. Send them for a scan. A scan will very quickly tell you if there's something there or not. Known it was something I could fight for, or something that GP could have recommended for me. Then that could have stopped my cancer coming back.
My name is Nick Puntis. I'm 46 years of age, and I was diagnosed just before my 40th birthday in April 2010. On this one particular occasion, which followed a number of runs where I started to feel more tired and laboured through running, and I couldn't understand why I was suddenly starting to get less fit. So on this one particular occasion, we'd run about 2 miles, and I literally couldn't go any further. It was like very, very bad indigestion. So following that event, I decided to go and see the doctor. The doctor gave me some tablets for indigestion, gave me a month on those, didn't do any good, was feeling worse and worse. Not dramatically worse, slightly worse. He then said, okay, let's investigate this further. So he sent me for a endoscopy, which they conducted, couldn't find anything. He still wasn't happy with me seemingly to be deteriorating slightly. First of all, ordered a stool sample, which indicated there was some blood in my stool. So he then sent me for a colonoscopy. And the most telling sign that there was something wrong was during the preparation for the colonoscopy, when the following morning, where if anything that comes out of you, it's going to be liquid following the prep for it. This is the morning of the colonoscopy. Mine was black liquid. So I went to the little hospital, just mentioned to the doctor that, is it normal for what's coming out of me to be black? He said, let's see. Did the colonoscopy and basically said, there's something inside you that's bleeding. We can't see anything up from the colon perspective, so we believe it's somewhere within the stomach. The following morning, I was given another endoscopy where they found a GIST, a gastrointestinal stromal tumour. It was sent off, the tumour was sent off for examination, and the most telling sign of it being a highly aggressive tumour was its mitotic count was in excess of 60. And for that reason, the decision was taken to put me on adjuvant imatinib for a period of a year initially, because the cancer drugs were only allowed it for a year. During that time, it was then extended to 3 years, so I was put on it for another 2 years. The 3 years ended in June 2014, so I came off imatinib and had the side effects, that some of the general side effects that you get with it. But when I came off it, I had a bit of a month to 6 weeks of feeling really poorly, and I was told that was sort of the effects of coming off the drug, quite a powerful drug for that period of time. That settled down. Now I have very, very small side effects, which may be just a lag from the drug, I don't know. But I get regular CT scans once every 6 months now, mainly because of the mitotic count and the fact that the chances of it coming back are pretty high. And I was told that they would just keep an eye on me in the hope that it won't come back. But if it does, I'm in the right place to have it dealt with and treated. And touch wood, as of now, there's been no recurrence of of GIST. From my perspective, my doctor was excellent at not saying it's indigestion or you're anemic. Although they were on his radar, he suspected that there might be something else going on. And my advice to every GP would be, don't just assume it's one of the symptoms are just due to one of the common problems or common diagnoses.
Okay, so my name is Vicky Rockingham. I'm aged 44 and I was originally diagnosed with GIST in 2007 when I had an emergency operation. My youngest son, was born in March of 2006, and afterwards I started to become quite anemic, and I think I was slightly anemic before I'd given birth to him. I think it was just put down to the fact that I was a vegetarian and I just had a child, so I was put onto iron tablets, and they seemed to maintain my iron levels because I'd become very anemic before that. And then I continued to take these iron tablets, and then eventually every time I sort of tried to come off them, my iron levels would drop again. So I just remained on them through to the point that I became ill at the end of 2007. We were visiting some friends down in Dorset, and we'd gone out for the day, and I'd always sort of, sometimes in the afternoon after I'd eaten, I always had this sort of funny feeling, and I felt a bit sick, but didn't really think anything of it. And we were eating an evening meal, which was like a tomato pasta. So, and I was given a glass of red wine, and I just took a sip and was like, I really don't want this, which was a bit unusual for me. So, and then I started to feel really sick, and I thought I was coming down with a sickness bug. So I went to the toilet, and we were supposed to be leaving to go and see my family. And I thought, I just don't feel right. I'm going to see if I'm going to be sick, just sort of almost make myself sick. So I was sick, and there were like globules of dark red blood in there. So I went in an ambulance to Dorchester Hospital. They gave me an endoscopy where they put the camera down into your stomach, and they found a tumour within my stomach, and next to it was an ulcer that was bleeding. And they'd removed a tumour. They thought the margins were clear, and that, but they weren't sure, so it would go off to the labs. And after they reckoned that after a couple of weeks I would know what it was, but they thought it was benign. And then about 6 weeks later, I was invited to my local hospital, Stepping Hill in Stockport, and they gave me the news that no, it was malignant, and that I would be referred to the Christie. And they had found some cancerous cells in the blood vessels, which indicated it might have spread. And they told me then it was a gastrointestinal stroma tumour. And so then I waited to be referred to the Christie. My first appointment at the Christie, they were lovely people, and they just explained to me that the labs where the tumour had gone to, they'd done a really good job. And so there was no real point in retesting it from their point of view. And they explained what a GIST, a gastrointestinal stroma tumour, was. I can't remember whether it was at that appointment or following ones that I then found out that I have wild type GIST, which is the one that's a little bit less predictable in terms of they haven't yet found the mutation, and therefore the drugs that are available are slightly less effective. After that, obviously I had scans, and they couldn't find it anywhere else. So for 4 years, life just went on as normal, and I went for checkups. And I'd just gone down to 6 monthly checkups. And then they found in November 2011 shadows on my liver. So they started me on a drug called imatinib. But we always knew from the start that it wouldn't be effective because of my GIST being wild type GIST. And then that I was on that drug for about 6 months, but we realised after 3 months it probably wasn't going to work. It showed no signs of working. So then I went on to a drug called Sutent, and I was on that drug for nearly 3 years. The main problems that I struggled with were hand-foot syndrome and my red blood cells dropping quite a lot. But I managed fairly well on that drug. And it seemed to be that it would hold things for 1 3-month period, and then after 6 months, it would grow a little bit, and then the next scan, it would be stable, and then the next one grow a bit. So about 2 years ago, so it must have been February 2015, they decided that it was becoming less effective. And at the same time, we knew regorafenib, which is currently available on the Cancer Drug Fund, was going to potentially be taken off the Cancer Drug Fund. So they applied to have me put onto regorafenib, and I've been on that drug ever since. It seems, at first, it took me a while to get the right dosage because the full dosage I found intolerable. I was having really heavy nosebleeds, but I would get spasms all down my back of my legs and my back at night. And I just after 4 days realised it wasn't going to work. So I dropped my dosage and then dropped it to half. But that was ineffective, so I'm back on 3/4 at the moment. And it seems to be a journey that both my consultant and I are going on, in that it's not been around that long, so we're learning at the same time how to manage the drug. And I had a couple of scans last Christmas which seemed to be showing that it might not be effective, but ever since then it has been effective, and it seems to be keeping things stable, which is good. Well, I have approximately, so this was about 2 years ago, 15 tumours now in my liver, and they're scattered throughout. I think they sometimes refer to it as peppering. So surgery is definitely not an option for me. The medical team at Christie had suggested silver bullets, which is known as SIRT, which is where they put little radioactive beads through your arteries into the tumours directly, and it's been very successful for secondaries from colon cancer and breast cancer. But unfortunately, NHS England wouldn't fund it because they said there's currently no evidence. And I think this is the problem for patients like myself with wild-type GIST in particular, and GIST. They're very rare cancers, so you sometimes need people to be brave in terms of funding treatments to get the evidence to see if it would work. But for now, I'm on regorafenib, and that's working. There will come a point in time where it will stop working, but nobody knows when that is. And so it's really about keeping myself as fit as possible. I still work full time. I would say the quality of my life is not always fantastic, but I just have to manage the side effects. And actually, if I think about it, being able to work full time, be a mum, be around for my children is the most important thing. And I'm managing to do that on this drug.